Hi everybody, here we are again. I don't know how to hold the friggin' phone. Okay, so we're gonna do a syringe draw using the butterfly needle. Okay, and so we've got the supplies ready for that. Let me turn the thing around. I'm the worst cameraman. Okay, so the supplies we need. Of course, we need a drape on a tray. We're wearing our gloves. We're wearing our mask. And then we have the supplies we need. Of course, we always need a tourniquet. We need gauze and or cotton balls. In our class, we usually just get both, just in case. We have a butterfly needle. Now, the butterfly needles that we get here at my office are designed, and probably the ones we have at school are probably the same way, where you can use them for butterfly collection directly into a tube, where we can remove the needle on the tip for a syringe butterfly collection. Of course, have a syringe. In the real syringe collections, if you were to do these in the real world, you would use a much larger volume syringe than 3 cc. It'd probably be 10, maybe even 20, to get the most amount of blood possible in one draw. Alcohol pads, when we have tubes. We also have a needle. That way we can put that on the syringe when we're done drawing blood to transfer the blood into the tube. Okay. Now, Eddie's never done it quite like this before. She's done other similar methods, but that's okay. Right?
Yes.
She's extremely competent. Been at MA for what, 10, 11 years now, Eddie?
Yes.
Yeah, so she knows what she's doing.
Yes.
So, yeah, let's do the whole.
Okay. Hi, my name's Addie. I'm gonna be your medical
Wait,
assistant.
don't touch her yet.
Oh, sorry.
Don't want to commit assault and battery. Sorry. Go ahead.
Okay. May I please verify your date of birth and your name?
Riona Penguin, 3/20/99.
Okay. Alrighty, and I see doctor ordered some blood work, so I'm gonna just check your pain.
What are the other things you ask?
Are you okay with needles?
Yes, I am.
Okay.
Okay.
Are you on any medications or blood thinners?
Are you on any medication? Are you fasting?
Yes.
Oh, very
Okay.
good. We forgot that earlier.
Alrighty.
Have you had your blood taken before?
Have you had your blood taken before?
Yes.
Okay.
With any complications?
Any complications?
No.
What arm did they use?
What arm did they use?
Stop. Okay.
This one? Okay.
One thing I didn't mention before, that if you're going to draw from the antecubital space, you want to tie the tourniquet about 2 inches above the elbow. Not too close, not too far away. Is that 2 inches? It seems longer than 2 inches. It's a little bit.
Think right here?
Yeah, there you go. See, nice and tight like before with that loop and tuck method. So that keeps the tourniquet out of the way and again makes it easier to open when we're ready.
Do you want me to open, Henry?
Did you find a vein?
Yes.
Like all painting?
This one. Pull this
Oh, look at that. See, you guys see there's a really nice obvious vein. See that sticking out. So, very good. So we're going to loosen the tourniquet.
Prepare the
Now
sauce.
she's going to assemble the supplies. Sorry, you're narrating and I'm narrating. I apologize.
And then the last one.
Guys, one thing to remember is I know you're anxious to do when you're anxious to do this. Please make sure if you have any supplies that need assembling that you do that before you tie the tourniquet and are about to puncture. You don't want to leave that because then that may lead you to hurry, and if you hurry, that leaves a chance you might accidentally make a mistake. We don't want to do that. You never want to hurry through a medical procedure. See, so she pulled the needle tip off there and then was able to screw it on directly onto the syringe. You didn't poke yourself, did you?
No.
Okay. Good.
Okay.
Okay, so she
Ready?
has everything she needs.
Okay.
So now we're going to tie the tourniquet.
Are you okay, Miss Riona?
Yes, I
Okay.
am.
We're drawing in here because it's a bigger room and easier to do everything like film. This is actually our cosmetic room, so we have Riona sitting in a chair that's not necessarily ideal.
Yeah.
Having a patient sit in a chair with their feet on the ground Whether sitting normally with armrests and backrests is, of course, ideal in case the patient happens to lose consciousness. It's much more easier to stabilize a patient who's sitting properly, just as a side note. Okay, and here she goes. So she holds the butterfly right by the wings, the rib side, so the bevel, the tip of the needle is up, which I forgot to mention last time. And the focus on this camera needs some help. Anyway, okay, and then again, a very nice, even, but confident puncture right into that vein. Bing! See how she gets it in there? You might get a little blood around the needle. That's okay. It just means she has an engorged vein, which is good to be engorged. And then, see, she's already, you can see blood flowing, and then she just pulls steady traction on the plunger to draw blood in. You get dark blood. That's enough. That's okay.
Okay.
Yeah, it's okay. So again, it's the tourniquet gets popped first. And then the needle, there's the needle. Because there's no tube, right? Applying pressure. And